Hello, everyone. This is Dr. Joe Morris, and I am the host of the radio podcast Informed Consent. Tune in weekly as I interview everyday people like you and me throughout the communities as they share their experiences and knowledge regarding health matters that will keep you informed and empowered. As always, it takes a village working together to make a difference. This is Informed Consent.
Thank you for listening to the radio podcast Informed Consent with Dr. Joe Morris, reminding you to live well, laugh often, and enjoy life.
Informed Consent.
Hello, everyone, and welcome to another edition of Informed Consent. I am your host, Dr. Joe Morris. Today, we have a special guest, Dr. Danny Colton, M.D. And Dr. Colton is a general surgeon with over 29 years of experience in the medical field. He graduated from Wayne State University School of Medicine and specializes in treating abdominal disorders such as gallstones, cholecystitis, appendicitis, and so much more. So to all our listeners out there, let's welcome Dr. Danny Colton to the show.
Hello, thank you.
So Dr. Colton, good morning, and thank you for being with us on Informed Consent. Let's just get right into it. I know we have a short time to talk about so many things, but let's talk about what was your inspiration to becoming a medical doctor?
Well, for me, being an African-American male growing up in inner city Detroit, and just wanted to help. I mean, it was genetics for me. It's just something ingrained. I didn't want to go on the bad side of the law, and I just wanted to help people. And that just inspired me from the time I was probably 6 or 7 years old. It never changed.
Yeah, well, there's someone in your family who was a previous doctor or any medical experience?
No, I was the first doctor in my family. My family is my mom is an educator. She was a teacher, and dad was an auto mechanic. So really, I was the first one to break through that barrier in medicine. And one of my driving forces, honestly, was always being told that I couldn't, and me wanting to prove that I could and that I should do this. And it was just something inside of me that drove me all the time. You know, you have a lot of friends who just say, oh, why are you going to school and why are you doing that? And why do you talk funny? And I just said, I'm talking educated. I mastered the language. So I want to, it's just something drove me over and over to push myself to become, a doctor and then a surgeon and then the first Black doctor in the family, and then just try to help as many other people along the way, and then just identifying with my patients.
And you mentioned a couple of key points, especially within the African American community. There are so many times you face so many obstacles, and when I believe that when there's a trial and tribulation, and you're able to overcome that builds resiliency, should I say, resiliency. And for all those who listeners out there, Dr. Colton is a testament that you can become anything you put your mind to, right? And you just have to continue to strive and persevere through some of the trials and tribulation. So Doc, what made you decide to specialize in abdominal disorders?
Well, I think the biggest thing is just going into, medicine and going into surgery. I'm able to, as a surgeon, I can see a problem and, train to fix it. If somebody has, for instance, appendicitis, you go in and you take it out and then they're cured. They're ready to go. Or if they have gallbladder disease or, gallstones, you can fix that problem. And something just drives me to want to help fix and that's a driving force. The other thing with me is with a lot of African Americans, I was told from a very early age that I couldn't, you shouldn't, you're not smart enough. And I just never listened to someone telling me that, you're too dumb to be a doctor or something like that. I just never listened to stuff like that. I just even, and it happens, unfortunately, the higher you go in education, it happens even at the college level, at the med school level. I've had people who are professors tell me, I don't think you should go into surgery. Maybe you should do some other field of medicine. And I said, no, this is what I want to do. Well, I can't support you. So, okay, fine.
Well, you have to think even in this day and time, and that still takes place. I later on in the program, we're going to have a panel of experts, and we're going to talk about this issue of discrimination within the health professions, and even the issue of a medical apartheid. And we'd love to have you back on the show to talk about some of those issues. Well, if I can kind of redirect us back here, because there's so many things we want to talk about. I recently read that approximately 11% of the population in the U.S. suffer from chronic GI disorders. And in the elderly, the population increases as much as 33%. Dr. Colton, based on your experience, are there health disparities that people of color face regarding preventative and treatment of abdominal GI disorders?
Yes, there are. And with the people of color, the biggest thing with us is not only access to healthcare, but the number one problem I find in, healthcare disparities is not just access, but diet. Our diet, we're not eating properly. And then most people can't afford to go to Whole Foods and buy organic and, fresh vegetables every single day. So therefore, we're in a community where the fast food restaurants are all around us with all the refried grease that's been sitting for 4 days. And they don't tell you that, but it's a fact. And so now you're putting that in your body, and that drives your abdominal problems. And then the elderly and then people of color aren't eating correctly. And so now, I used to tell my kids, if you eat pancakes every day with all that sugar for 10 plus years, there's no way you're not going to have diabetes when you're 40, because you've been eating sugar pancakes for 10 years. And it doesn't mean anything when you're 10 years old, but when you're,
right.
Yeah, you just want the pancakes when you're 10 years old. But
now, Doc, I love pancakes. Are you saying don't eat any pancakes?
No, I'm not saying that, but I'm just saying it versus, your home cooked batter with fresh pancake batter, put some apples or something in there to make it fresh versus some processed milk or whatever that you're putting in there, and you're getting it from the fast food place that put it on the grill with the bacon and everything else. No, that's not healthy, period.
I grew up and there's this proverb. I can't tell you exactly who said it, but I do remember hearing, you are what you eat. And what you're saying is what we put into our bodies ultimately will impact our health, and in particular GI disorders.
Correct.
So it sounds like you're saying so the possible solutions are having access to proper nutrition, and not only that, starting very early in life, as early as maybe kids, right, and their parents, and their influence on what they expose the kids to. Doc, let's take a quick break. I want to come back, and I want to talk about a current issue that's happening today, and that relates to COVID-19, and get your perspective. Listen, we'll be right back on Informed Consent. I'm on the air with Dr. Danny Colton.
We will be right back after these important announcements.
Informed Consent.
Hey everyone, this is Dr. Morris. Did you know within the African American and Latino communities, research has suggested that the prevalence of Alzheimer's disease is much higher than other ethnic groups. In fact, African Americans are 2 to 3 times more likely to get Alzheimer's disease than Caucasians. Currently, there is no cure for Alzheimer's disease. Therefore, more awareness, education, and support services are needed to help families and loved ones cope with this chronic illness. To learn more about Alzheimer's disease and other types of dementias, please visit icare-alz.org. That's icare-alz.org, or your local mental health center that focuses on helping older adults. Remember, it takes a community working together to make a difference. This is a public service announcement.
Well, welcome back to Informed Consent. I'm Dr. Joe Morris, and you are listening to Informed Consent. And we have Dr. Danny Colton M.D. on the line here. And Dr. Colton, so over the past year, there's been a lot of discussion regarding COVID-19. Can you talk about your experience with the virus and what are some key take-home points regarding COVID-19?
Sure. So me being a physician and, last January, when this all started, I kind of was ahead. I knew it was coming. And over the last year, I probably have seen several hundred, if not a few thousand people walking in and out of ERs every day. And for me, one of the biggest things that I've seen is just, what's sad is when someone gets COVID, a virus, and then they're isolated, then they can't see their family, and then something bad happens or they don't make it. And just dealing with that part of COVID, just dealing with people's respiratory and their GI and how they present it. Some people didn't have symptoms and they just would all of a sudden get short of breath or have abdominal pain. And as a surgeon, we were thinking, oh, maybe they have appendicitis, and then boom, it's COVID.
And wow, Doc, are you saying that because in the media and to the lay person, they may have the perception that COVID is only related to respiratory illnesses, but you're saying GI pain could be another symptom?
Yeah, COVID can present in multiple different ways. It's a virus. I mean, you can have muscle aches. Some people are getting blood clots in their legs. Some people are having lung problems, heart problems. Shortness of breath is common. Yes, it is common with the lungs, but some people are getting abdominal cramps and they come in. And then the biggest problem with, people of color is they don't want to come in. They don't want to come in. So their care is delayed. Now they have lack of access and delayed care. So let's say it is just a straightforward appendicitis, but some of them are so terrified to come in, and this is young and old, because they don't want to catch COVID in the hospital or they don't want to catch it walking down the street. So that's a big problem right there. And COVID presents in many different ways. I mean, we all say, oh, they're short of breath and, oh, I was on oxygen. But there's other ways too. This abdominal pain, the blood clots in people's legs. Some people's memories are foggy after they get it. They're not the same. I was blessed to have treated all these people and not convert. I wore a mask literally everywhere I went. I washed my hands. I wore gloves when I could. So I think the mask is, if I had one single preventative measure as a public health doctor and all of this, I'd say the mask. The mask. Because you're going to touch stuff with your hands.
Wow, Doc, that was you answered my next question I had. As we kind of wrap things up, what was one of your key take-home points? And it sounds like you're saying, wash your hands, and wear the mask. Definitely wear the mask. Well, with Doc, I want to first thank you for taking a moment to be on the show, and we know that you're busy. And so, as we always say, as we kind of wrap things up, do I have your consent to release this information to the people?
Absolutely. And I appreciate you allowing me to talk and come on the show. I'm just honored that you would invite me.
Well, there you have it, folks. You've been informed, and Dr. Colton has given his consent to release his information. So with that being said, join us next time on Informed Consent as we keep you engaged on information that will empower you to be a better person. And as always, it takes a village working together to make a difference. Thank you again, Dr. Colton. Until next time, we'll see you on Informed Consent.
Join us next time as we continue to explore topics that keep you informed and engaged on matters that promote healthy lifestyle.
Informed consent.